Hi, I'm Dr. G. You're a mad shrink. I'm a board-certified psychiatrist here to offer you information and advice about mental health and to challenge your assumptions. And I'll be talking today about the question, is your therapist right for you? With 11 points for you to consider to decide that. Now, first, several generalities about psychotherapy, which I've been doing for more than 5 decades, along with other aspects of psychiatry. A dirty little secret among those in the mental health professions is that not all psychotherapies were created equal, and not all therapists are equal either. As far as qualifications and the abilities of therapists, there may be good ones, and there are also not so good ones. But more important than whether somebody is a good therapist or an excellent therapist is whether that therapist is good or excellent for you, because the fit between therapist and client or patient can be very individualized and idiosyncratic. A second generality is that longer duration of therapy is not necessarily better. All other things being equal, there's no evidence that the effectiveness of psychotherapy depends upon extended length. There are certain psychotherapies, for example, that have produced and published about dramatic results within just a short number of sessions. And I've used them myself and have witnessed that. So, years-long psychoanalysis, some people will be offended by this, but there's absolutely no evidence that its length offers any advantage if you're in therapy because you want to change something about yourself. You want to solve or resolve or cure some problem that you are having with how you're thinking, feeling, or acting. If you simply want to understand yourself better within the framework of psychoanalytic theory, that's another matter, and then it can be an interesting and perhaps useful exercise in that respect. But if you're like most people, you go to psychotherapy because you want to change something about yourself, then length is not the most important factor. Third, and this may be a surprise to some people, insight is overrated. There is absolutely no evidence, zero, zilch, nada, no evidence that the development of insight, so self-understanding, plays a significant role in producing better results in psychotherapy. Yes, there are some forms of psychotherapy, psychodynamic psychotherapy, for example, that have as a central emphasis the production of insight on the part of the client, and people can change. However, there are strong arguments why when people change in psychotherapy, it is not because they've suddenly understand themselves better. Insight often happens after they change, and they change for other reasons, which I outlined in my book, The Healing Paradox. And then they change, and then they realize, oh, yes, that's why I was feeling that way all that time. That's why I was doing something all that time. And as I hinted earlier, there are forms of psychotherapy that totally de-emphasize the use of insight and don't try to cultivate it at all. And their emphasis is on helping people to change. I'm talking specifically about the strategic and systemic forms of psychotherapy. Dr. Milton Erickson, the late Dr. Milton Erickson, who was probably the world's greatest clinical hypnotherapist and an innovator in the use of brief strategic psychotherapy, who said, and I think rightly so, that the world is filled with people who know exactly why they're miserable. And it's also filled with a lot of people who are happy, who have no idea why they're happy. They just are. So insight has its place, but it's by no means the be-all and end-all of therapy. At any rate, to get to the 11 points to consider in deciding whether your therapist is right for you, the first is whether my therapist is providing and offering a therapeutic contract. Now, what is that? It's not usually any written document, but it's an agreement about what will be done during the therapy, what issues are going to be addressed, the goal of therapy, as well as administrative details like how often we'd be meeting, how long the sessions will be, for how long we'd be meeting, and the like. Now, why is this important? I assert that some form of therapeutic contract is essential if any psychotherapy is to be effective. Why? Well, the two of you, you and the therapist, are collaborating, and you need to be knowing that you're working on the same thing, that you're in the same wavelength, so to speak, about what you're trying to do. And knowing in advance what your goals are will help you and the therapist know if you have achieved what you wanted to get out of therapy or if you have not. A third benefit from a therapeutic contract is that can provide guidelines, guardrails for the two of you to know when an issue that comes up is relevant to psychotherapy or it's not. So that you may start, let's say I, as a patient, may start wanting to work on the problems I have with failing relationships. And we start talking about that, working on that, and then I bring up about an irrational fear of cancer. So we have to make a decision whether to put that on the back burner because that's not what we're trying to work on, or we need to revise the therapeutic contract because it's so important that we need to include that. So that helps to guide us about what's okay to bring up and what is less relevant and that we have to put on the back burner. If a therapist does not offer you a therapeutic contract, then you're at great risk of engaging in therapy without a compass or a rudder, in which case you may be continuing in therapy until well after the earth suffers the heat death. Second point to consider, is your therapist agreeable to helping you to solve, resolve, get rid of some problem, to help you cure yourself of some problem that you want to change about yourself? If the answer is anything other than that, so that the therapist is there to help you cope with something, to manage something, some verbiage like that, then it is less likely that the two of you will be able to reach an endpoint when you have actually changed something. The emphasis for effective therapy will generally need to be on changing something. Third, does your therapist focus upon or recommend medications? Now, when I say therapist, I mean a therapist who's not a physician, either with an MD degree or sometimes a DO degree. So does your therapist focus upon that or recommend medication for the problem for which you sought the therapist's help in the first place? When a therapist does that, that's a giveaway, in my view, that the therapist does not have the confidence that he or she can help you solve this problem himself or herself. Now, this isn't to say that all problems are solvable through psychotherapy. No. But the point is that whatever you agree upon to work on should be solvable. For example, if you have severe mood swings, may have a bipolar disorder, and you also have a problem with binging, eating, it would be very reasonable for you and the therapist to decide, yes, for these mood swings, I need to see a doctor who could prescribe me medicine to stabilize my mood. But the therapist and you agree to work on your compulsive eating. If the therapist then recommends that, oh, well, why don't you see a doctor also to receive medicine for that, you can bet however much money you want, the therapist is not capable of helping you to solve the eating problem by himself or herself. Maybe there'll be some useful addition to the treatment that the therapist can provide to help you. But if you're looking for a therapist who will be most effective for you, this is a telltale sign if they recommend medication for something that can be solved through psychotherapy. Fourth point, does your therapist listen to you? Now, by listening, I'm not talking about does the therapist sit back and say almost nothing and let you do most or all of the talking. That's not an indication necessarily of effective or attentive listening, but rather, does the therapist, in however many or few words and nonverbal behaviors he or she manifests, does the therapist indicate that he or she is attentively listening to you and understands you and what you're trying to say, or at least is trying to make a strong effort to understand? So that's really important in assessing your therapist. Does your therapist challenge you? Challenge certain of your assumptions, thoughts, or behaviors? Very important. If not, then there's a likelihood that there really isn't the kind of therapeutic discomfort that the therapy produces in you so that you become more prepared to change. Every therapy to be effective, the therapist has to challenge you in ways so that you feel at least a little bit uncomfortable. If you don't, and 100% of your therapy and therapeutic interactions are comfortable, then get a dog instead. Does your therapist frustrate you? And by that, I mean, does your therapist at times refrain from giving you what you want or answering every question? Frustration is necessary for you to grow, as it is for children when they're growing. It's necessary for all of us when we're trying to change ourselves. It's necessary for all of us to be able to get out of our comfort zone, to change. So next point is when a therapist indicates that he or she, not by saying that he or she cares for you, but demonstrates that he or she cares for you and is doing his or her best to understand you and also frustrates and challenges you, then you have a winning combination. The next point, does the therapist engage and observe, I should say, what we in the mental health fields term boundary or frame requirements? Now, those are certain guardrails in terms of the structure of therapy. I'll illustrate. Is your therapist on time? Does your therapist give you the allotted amount of time for the sessions? Does your therapist focus upon you with undivided attention, brooking no interruptions from calls or secretaries? Does your therapist maintain confidentiality, communicating with no one about you without your permission, except in a life-threatening emergency. Does your therapist practice appropriate self-disclosure, disclosing something about his or her feelings or his or her personal issues or history? Now, there can be a fine line between therapeutic self-disclosure, in which the therapist divulges these things to help you to change, a fine line between that and self-indulgent self-disclosure. But if the self-disclosures of your therapist make you uncomfortable, I suggest you bring it up. And if you still feel uncomfortable, you may want to consider another therapist. The therapist should engage in no inappropriate physical contact, nor should the therapist seek you out for gratuitous social contact outside the sessions. The therapist should expect fair remuneration consistent with what's being charged by similar professionals in your geographic area, and deal with health plans and insurers in an honest manner. So those are the boundary and frame requirements. If they're violated, it's difficult for fully beneficial therapy to proceed. And as I said earlier, if you're feeling uncomfortable about a violation or seeming violation of one or another of these requirements, bring it up with your therapist. That's what you're there for. Don't make it into a false and phony therapy by not bringing up your discomforts. And you could discuss it. Therapists can make honest mistakes. There are also some unethical or inept therapists. It's a mixed bag. But if you feel uncomfortable still and unhappy still after a discussion of boundary and frame requirements, then I suggest you find another therapist. Item 9, are you making progress in therapy? How can you tell? Well, that's where the therapeutic contract again comes in very importantly. You can refer back to it. I would say in most therapy, there are variations, but if you've been working with a therapist regularly and a year has passed and you see no progress toward the goal that you and the therapist have agreed on, then bring it up. And in the hopes that one of three things happen: either you feel you're on the right track after discussion and you decide to give it another 6 months, or the therapist listens to you and agrees with you to change the nature of therapy, perhaps the focus or the form of the therapy. And the third option is to find another therapist. But it would be important to discuss this with the therapist and not show up without discussion, because the therapist may find that there's some other way to help you reach the same goals. Item 10, does the therapist engage in what I call the fallacy of interminable therapy? So does your therapist, after a year has passed, say, it's true that you haven't really achieved the goals that we discussed at the beginning, and the only progress that you've made is learning a new guitar chord, but think how much worse you might have been if you hadn't had therapy with me to begin with. That's the fallacy of interminable therapy that presumes the existence of a parallel universe in which you proceeded along, except with no therapy, instead of seeing this particular therapist, which is as erroneous a form of reasoning as if I said that if I hadn't eaten broccoli last night, which I did, if I hadn't eaten broccoli last night, I would have dropped dead. A parallel universe. So if you and your therapist find that you're engaging in this fallacy, consider that you might be treating your own therapist's delusions of effectiveness rather than your own problems. 11th point. This will sound strange because I am a psychiatrist, but I'm telling you to avoid psychotherapy with psychiatrists, in other words, physicians with MDs or sometimes DOs. Avoid psychotherapy with psychiatrists who are younger than 65 years old. Why do I say that? Because they don't know how to do psychotherapy very well. They don't have adequate training anymore. It used not to be so. Psychotherapy was what psychiatry was almost all about. We boasted a pantheon of superb psychotherapists over the years. But gradually, psychiatry became more and more biologically and reductionistically oriented. And now psychiatry pretty much deals with things. By things, I mean diagnostic labels, neurotransmitters, and drugs. Things. Now, there are some maverick psychiatrists, rogue psychiatrists, who have become excellent therapists despite their training, despite the orientation in their residencies, and they are excellent. But you're involved in a crapshoot in which you're likely to use if you see a psychiatrist under 65 because you want to change. How about other psychotherapists from other disciplines, psychologists, social workers, counselors? They don't deal so much with things the way psychiatrists do. They deal with process, the ebb and flow of human emotions and thoughts and interactions, which is the proper focus of psychotherapy, because psychotherapy involves people changing the flow of their feelings or thoughts or behaviors. So, anyway, even with these 11 points in mind, how do you find a therapist who will be right for you, will help you? Well, of course, there's word of mouth. If you have a friend or colleague or an aunt, let's say, or an uncle, who saw a therapist who wasn't merely nice, wasn't well-meaning, wasn't kind, but was effective and helped them actually get rid of the problem for which they came to the therapist, take note of that, because good therapists who do that do not grow on trees. Of course, there are always the online reviews too, and similar considerations can apply there. But really, perhaps for many, the only way to maximize your chances of finding the right psychiatrist for you is to see one for a consultation, get a sense of whether you're comfortable with this person and he or she attentively listens to you and exudes some degree of warmth. And then when you go back, keep these 11 points in mind. I wish you all well, be well, and it's a pleasure being with you today, and I look forward to being with you the next time.